Welcome everyone to this Doctors for America Advocacy Grand Rounds. My name is Shuttle Shah. I'm a neonatologist at the Maria Frere Children's Hospital in Valhalla, New York, and a professor of pediatrics and neonatology at the New York Medical College. I'm also a 2023 Capello Health Policy Fellow. We are so bring this Advocacy Grand Rounds to you. We have an amazing speaker. I will introduce her, then we will let Dr. Fiscus talk. And then, of course, if you have any questions, you can chat them and we'll engage in a little bit of a roundtable discussion afterwards. So I'm pleased to introduce Dr. Michelle Fiscus to this Doctors for America Advocacy Grand Rounds. Dr. Fiscus is a former member of the National American Academy of Pediatrics Board of Directors, and in that role helped direct national and child health policy for the country's 68,000 pediatricians. She currently serves as the Chief Medical Officer for the Association of Immunization Managers, leading a CDC-funded project to increase COVID-19 immunization rates in children. As the former medical director of the Tennessee Vaccine Preventable Diseases and Immunization Program, Dr. Fiscus attracted national attention when, contrary to directives from her state government, she continued to provide evidence-based information regarding immunization to the public and to county health officials. Her subsequent removal from her state position in Tennessee placed her in the center of a national debate between politics and public health information, particularly surrounding immunization. Her defiant and heroic stance to continue to educate the public about the safety and importance of vaccination in the face of tremendous political pressure has really made her an icon amongst pediatricians who are too often now thrust on the front lines of this and, frankly, too many other culture wars. I can tell you from knowing Dr. Fiscus now for a couple years, she's also just really cool. She received her undergraduate degree and medical degrees from Indiana University and completed her residency at the Riley Children's Hospital in Indianapolis. She's a member of the American Academy of Pediatrics, formerly Board of Directors, and has also served again on the work groups for the Advisory Committee on Immunization Practices. So with that, I will turn it over to Dr. Fiscus, and if you have questions, please feel free to put them in the chat, and we will ask them at the end of the talk. Thank you so much.
No, thanks, Shuttle. I've been looking forward to this for a really long time and appreciate the opportunity to speak with all of you. I spent a lot of time thinking about what I wanted to share with you, and my ability to share some messages has changed a little bit. But really, what I'm hoping to do is to fire you up a little bit at the beginning of this legislative session that we're all entering into right now, and to make you aware of just what's happening on the state level across the country, and make you a little uncomfortable, I hope, about the thought of just sort of sitting on your laurels and thinking that, well, maybe if I'm in a blue state, I don't have to worry about things so much. So thanks for indulging me for a little while and letting me share some of my thoughts. So as I was researching this talk, I found this quote from the former commissioner of the New York City Department of Health, who went on to be the commissioner of the State Department of Health up until, I think, the end of 2022. And this quote just really resonated with me. Much is conflated when medicine and public health attempt to fly below the radar of politics by donning the armor of scientific objectivity, guarding the faith by positing the cold logic of the scientific model. And she actually said that in 2017. And I think it just really resonated with me about, we are in an era where just being an expert in medicine is just not enough anymore to get people to understand what they need to do. And we really, as physicians and especially as advocates, need to find other ways to communicate than what we're really used to doing. And so, I wanted to point out that there have been skeptics for a really long time. So Pythagoras in about 500 BC said the earth is round, and we still have flat earthers roaming the planet right now. And then all living things can trace their descent to a common ancestor, Charles Darwin, 1850. And, we've had the Scopes monkey trial in my former state of Tennessee. We still have people wanting to ban the teaching of evolution in public schools. This is still going on. Robert Koch in 1887 that said that specific microbes cause specific diseases, and we still certainly have disease deniers. So we have been dealing with these issues for literally centuries and millennia. Um, but I really think we can't downplay the impact of the internet and social media and the 24-hour news cycle, and how that has strengthened and given air and volume to the people who maybe used to just sort of sit in a hut and think that the earth was flat, that now have followers and communities that they can connect with, that breathe the same kind of air that they're breathing. And I wanted to pause in this for a minute to talk a moment about racism in science and medicine. And so I'm going to be talking a lot about misinformation and disinformation and people who believe in conspiracy theories and all of that. And that is very different, I think, from mistrust of science and medicine because of what has happened historically. Tuskegee, that went on for 40 years, the Henrietta Lacks, J. Marion Sims, who was doing gynecologic surgeries on enslaved women without anesthesia. I mean, there are reasons, very valid reasons, why there are populations among us that have a huge distrust of science and medicine, and that is very different. And I just want to compartmentalize that from kind of what's been happening with more of the right wing evangelical Christian kind of movements around medical freedom and all of that. So I wanted to, one, acknowledge that in medicine we have done terrible things to people, and two, to very plainly state that I am not talking about these populations during this conversation. I also should probably take a second to just say that I am speaking as an individual who was invited to give this talk, and I am not speaking on behalf of any of the 501c3 organizations that I am affiliated with, who are not permitted to speak about things like people who are running for president. So if you're a pediatrician like me, 1998 was really when a lot of things changed for us. And that was when Andrew Wakefield published his infamous article in The Lancet, trying to connect MMR and autism. And really this, for pediatrics, was kind of the advent of the modern anti-vaccine movement, I think. And unfortunately, it took 12 years for The Lancet to retract that article. So even though it was shown to be bunk, and Andrew Wakefield was stripped of his MD in England, and all of that, it took a really long time for the publication to actually come out and retract the article. And so an awful lot of damage was done in those 12 years, and really in the couple of decades since Wakefield's paper. And Wakefield now lives in Texas, where he's good buddies with Del Bigtree, and they've produced movies like Vaxxed. Del Bigtree is now the public relations person for the Robert F. Kennedy Jr. Um, presidential campaign. So all of this kind of comes full circle. It was after Wakefield that we started to see people like Jenny McCarthy and other celebrities start to come forward, also espousing this anti-vaccine theory. Rob Schneider of the Happy Gilmore movies is probably one of the most vicious, especially on Twitter. He put out this tweet after the COVID vaccines came out: just say no and keep saying no. Over half of the US population is continuing to say no to this unapproved experimental gene therapy. My body, my choice. And then Second Amendment for this. So not only pushing back on science, but actually intimating that maybe there should be violence associated with that. In 2019, the World Health Organization came out with its 10 threats to global health. And, I think back about this, that came out right before we realized that we were moving into a pandemic. And, if you look at that top 10 global influenza pandemic, well, we thought it was going to be influenza. It just turned out it wasn't. Ebola and other high threat pathogens and vaccine hesitancy were all in the top 10. And this was a pre-pandemic prediction by the World Health Organization, which was really fairly right on of what we ended up coming into very shortly after. It was in March that the WHO declared the coronavirus pandemic. And then about 2 days later, President Trump then declared the pandemic as a national emergency for the United States. Um, and, if you recall back to that time, there was a lot of downplaying. I remember him talking about how there was COVID on a cruise ship off the western coast of the United States, and he didn't want the cruise ship to dock because then we would have 15 more cases of COVID in the United States. And at the time, we only had a handful of cases. When he came out to talk about Operation Warp Speed, and we can go for a long time talking about naming it Operation Warp Speed, in May, in that same announcement, he said, and I just want to make something clear, it's very important. Vaccine or no vaccine, we're back and we're starting the process. And in many cases, they don't have vaccines for a virus or a flu comes and a virus or flu comes and you fight through it. So, on the one hand, saying we're going to try to make vaccines as quickly as we can. And in the same breath saying, but we're going full steam ahead anyway, even though it's May of 2020. We're going to begin opening things back up again and trying to take away a lot of the protections that we had around COVID. And you think about how early that was in the pandemic compared to where we ended up 2+ years later. It's 3 years later, really. To think, looking back, that they were talking in May of 2020 about not really needing to pay much attention to this pandemic anymore. In September of 2020, Trump said that coronavirus, quote, affects virtually nobody, and talked a lot about how young people have wonderful immune systems and they can just fight this off, which, I mean, is not completely untrue. But October 1st was when he himself ended up getting COVID-19. Of course, this was pre-vaccine, and received all kinds of treatments in the hospital. But then just about 4 weeks later, came out saying cases are up because we test all the time. And so the only reason that we know about the cases is because we're testing. And if we weren't testing, we wouldn't have so many cases. And so, really feeding back into this downplaying of the pandemic. And so if you think back about the influence that he's had over the past several years, he was really laying the groundwork for this distrust in medicine all the way through the pandemic, not even counting the sunshine and bleach and all of those comments. And so I found this really interesting. So this is from Kaiser Family Foundation, and they did a poll before the election, before the FDA gave EUA to the vaccines, and wanted to know, are you worried about the FDA rushing to approve the vaccine due to political pressure because President Trump wants to have the vaccine before Election Day? And it's really interesting looking at these numbers because they do a complete flip later on. So you've got the majority of Democrats saying they're very worried that vaccines aren't going to be safe and that the FDA is going to rush this to get this out for Trump. And you've got a relatively small number of Republicans saying that they're worried that, hey, 41%, we're not at all worried that they're going to be rushing this vaccine. And then the election happens. And then after a while, it becomes apparent that Biden is going to be placed in office, and you see everything flip on its head as a result of this. So on December 8th, right before the vaccines came out, I think we started administering our first vaccines on December 21st or 23rd of 2020. Trump came out and said every American who wants a vaccine will be able to get the vaccine. And that is a statement that you can hear resonating across, especially Republican states that didn't want to have any kind of vaccine mandate. You would have that kind of language. Every American who wants the vaccine can get a vaccine. We're not going to encourage you to get a vaccine. We're just going to tell you that it's available. And we think by spring, we're going to be in a good position that nobody would have believed possible just a few months ago. Yeah, amazing, really amazing. They say it's somewhat of a miracle, and I think that's true. December 8th. So after the election. But when there's still maybe some uncertainty about whether or not we're going to have the the change in power that the voters said they wanted. Um, so on March 1st of 2021, this is after January 6th, it's become apparent that Trump isn't going to go back into office, and he and the First Lady quietly received their COVID vaccines back in January. Don't tell anybody, don't make any kind of announcement about it. And so you go from this, hey, I've done this fantastic thing, which was fantastic. I mean, we need to give credit where credit's due with that. He did get these vaccines made in an unbelievably short amount of time. But you see that go from, well, it would have been one thing had this come out prior to the election, but now it's in Biden's hands, and that whole political thing starts to flip on its head. And so I'm a pediatrician. I was in private practice for about 20 years, and just burned out. Decided I needed to do something else, and I went to public health in 2016, first in maternal child health, and then in January 1st of 2019, I took over the Tennessee Vaccine Preventable Diseases and Immunization Program in Tennessee. And so I walked into what was left of a multi-state hepatitis A outbreak, and then went into a measles outbreak and a mumps outbreak, and then rolled right into COVID. And so timing for me was not great, although it was also the most amazing and best job I've ever had and probably will ever have. But we were very used to flying under the radar. We made sure that when kids poop in the pool that they get closed. We made sure that when people don't put their chicken at the right temperature, that the restaurants get closed down. We figure out where the E. coli in the water came from. And so this was a big switch to suddenly have this massive pandemic to deal with, and to be trying in real time to issue quarantine and isolation and masking recommendations, and what do we do at the schools, and what do we do with colleges, and what do we do with people who are unhoused, and all of these things everyone's trying to scramble and do at the same time. And so we suddenly were under this very bright light that we weren't accustomed to having. And at one point, there were things like ticker tape parades where everybody was celebrating the healthcare workers that had been working through the pandemic and public health. And everything was rah, rah, this is great. And then things became not great at all. And we started to see things like public health um, workers and especially state officials in public health being either pushed from their jobs or fired, just downright fired from doing their jobs. So in California, their chief health officer in Orange County ended up resigning after residents took a banner depicting her as a Nazi to a public meeting and held protests outside of her home. Amy Acton in Ohio, the chief health officer there, got a lot more publicity around her resignation. But again, protests at her house, anti-Semitic vitriol slung at her, the legislative efforts to try to curb her authority to be able to quarantine or put out isolation orders. It started to become this very toxic place. And it didn't really matter if you were in a blue state or a red state or a purple state. This was happening everywhere. And in for the people that were in my position as head of the state's immunization programs, there are only 64 of us in the country. There's the 50 states. There are 6 large cities, DC and others, that are funded separately by the CDC. So they each have an immunization program manager, and then we have the U.S. territories and freely associated states. So there's 7 of those. So 64 of us total. And over the course of the pandemic, 2/3 of us left our jobs, either retired, resigned, or fired. Um, and so when you think about the fact that a lot of these people had the institutional memory of the H1N1 pandemic, or just understood how to do a rollout during an epidemic or a pandemic, and all of these people are gone. And along with, a large number of career public health people who decided to get out. And so, really that left our public health infrastructure on a very shaky foundation for the next pandemic. And it really has not yet recovered from that. And then there's my story, which I can't really go into anymore, but when I was at the state, my husband was also on the local school board, and we lived in a fairly affluent county outside of Nashville. And there were a lot of folks in our county that we had lived in for 24 years that were not interested in science. This became a hotbed of activity for Moms for Liberty, which is kind of a fringe organization that began in Florida. The Moms for Liberty group in our area was at the start of the pandemic busy protesting a book that second graders were reading about seahorses, because seahorse males are the ones that incubate the embryos. And so if we taught children about seahorses, then that could cause gender confusion. And so in the school board meetings, they would walk around with giant posters of pictures from the seahorse book, which is what they were really interested in until this happened. And then it became masks and vaccines and remote learning and all of that. And so my husband and I became targets in this community where about a third or so of the people who live there kind of fell off sort of the crazy side of things and decided that he and I were going to go out under the veil of darkness and vaccinate the children of Williamson County against COVID-19 without parental permission to do so, because we obviously had ultra cold Pfizer vaccine sitting in our Kenmore freezer. But it became a situation where we felt like we were really not safe to stay in the area we were. And so in the fall, very shortly after I was let go from the state, fall of 2021, we put the house that we had built for our retirement up for sale, and we moved to Northern Virginia. And the reason we chose Northern Virginia is because I was still on the board of directors of the AAP, and my states that I was the chair for were North Carolina, South Carolina, Kentucky, Tennessee, and Virginia. And so of those, the only palatable option was Virginia and the very, very northernmost part of Virginia. So like literally we were just a toe away from the DC border. We moved to Arlington the first year we were here. And when you drove out of our neighborhood, there was the Air Force Memorial is right there. So, and we were right there, as close as we could get to DC as possible. And we decided that we would stay here for 2 years until I finished my board term, and then we would decide what we were going to do from there. But anyway, if you have interest, BBC actually did a documentary on our story. It's called Infodemic Tennessee. It's on YouTube. And if you just put in BBC Infodemic Tennessee or BBC Tennessee, I think it's probably the only thing BBC has done on Tennessee, really. But you should be able to find it there. It's not very long. You can like watch it while you're on the commode. It's like 30 minutes. So anyway, moving onward. So, what we have seen since the pandemic is this onslaught of anti-science, anti-vaccine, anti-COVID common sense kind of bills. And so the National Conference of State Legislatures has this database that you can look at. And so in 2021, there were more than 800 bills just related to vaccines, mostly COVID vaccines. 590 in 2022. In 2023, there were 740. So far in 2024, we've got about 236 bills filed in 37 states. Most of them are still against vaccines in some way. But some of them are positive, but not very many. And um, and then this is from Kaiser Family Foundation. So over half of the states have rolled back public health powers during a pandemic. And so 26 states have enacted laws that permanently weaken government authority to protect public health. And so you might see your state up there. You might not even know what's happened, but my state of Tennessee and Shuttle State of New York are on that map. A lot of this legislation is driven by ALEC. So ALEC is the American Legislative Exchange Council, and they say that they are America's largest nonpartisan organization of state legislators dedicated to the principles of limited government, free markets, and federalism. But what they tend to put out is draft model legislation to undermine public health authority, to put more power into the legislative branch and to take power away from the executive. So they drive a strategic effort to limit local authority. So they're all about preemption at the state level, and then policy making through state legislative, issues in that way, and trying to limit the executive branch. And they claim that 1/4 of state legislators across the United States are members of ALEC. And ALEC is, if you look from state to state to state, you can see the same legislation being introduced across the US, and ALEC is often the one that's drafting that. So these are just some of the laws that were enacted since the pandemic. So legislative authority saying, if the governor creates a state of emergency, the legislature can just overturn that. Many times when these laws have come through, the governors have vetoed those laws because, obviously they don't want to lose their power. But then there is a supermajority that can override the governor's veto. In Kansas, they have designated county commissioners as the local board of health. So a local health officer has to go and get approval from the county commissioners before they can put in any kind of health regulation in that area. The county commissioners can opt out of the governor's public health orders, and they have also put limits on things like contact tracing. And the lack of foresight with these laws is really quite stunning. There's one law that well, in Missouri, that prohibits quarantine. They have enacted that in the state of Missouri, you can't order quarantine. And so when measles hits Missouri, which it likely will, because I think we're all going to see it in the next couple of years, that's going to be a problem when by law you can't quarantine someone. Um, there are prohibitions against face masks that are statewide. There's just a lot of really short-sighted laws that are being put into place that are not going to be very easy to overturn in some kind of an emergency. And then on the vaccine side, you have Robert F. Kennedy Jr., who started Children's Health Defense. And if you don't know Robert F. Kennedy Jr., you should. He is, yes, a Kennedy, but an environmental attorney. And I often try to figure out where his ideas come from, but he says he is not anti-vaccine, but he is staunchly opposed to vaccines, and now running as an independent for president, and has this vax unvaxxed bus that is driving around. So he has stepped down from the Children's Health Defense. But if you look at their site as the page scrolls through, it is all about Robert F. Kennedy Jr. So he is very much still present and fundraising through the Children's Health Defense. And so they are great spreaders of misinformation and disinformation about vaccines. And again, Dale Bigtree is Robert F. Kennedy Jr.'s good buddy and a media producer, who and a conspiracy theorist who is now his publicist. So some of the anti-vaccine legislation that's been enacted, there's all the COVID stuff that you can never ever require a COVID vaccine for school entry. But also in Florida, since last year, there's a prohibition of a governmental requirement to receive an mRNA vaccine of any kind. And so, mRNA is really kind of the vaccine technology of the future. They are incredibly effective vaccines. There's an mRNA-based flu vaccine that's coming out. There will be others that come out. And Florida has prohibited the requiring of any of those vaccines. My former state of Tennessee, just this last year, now says that homeschooled children don't have to be vaccinated unless they're participating in school-based sports. Um, in Montana and Idaho, yeah, you can still require vaccines, but you also have to tell the parents now about how they can get a non-medical exemption. And then just yesterday in Tennessee, Joey Hensley, who was the one who put in the law about not having to vaccinate homeschool kids, now has introduced to remove the declaration in Tennessee statute that it's the responsibility of parents to vaccinate their children according to the CDC and the AAP, and replace it with a recommendation that children be vaccinated with vaccines recommended by the Commissioner of Health when advised by the parent or legal guardian's trusted healthcare provider. And Joey Hensley is one of four physicians. He's a family medicine doctor in the Tennessee General Assembly. So this is to underscore that they are us in a lot of cases, and that makes it very difficult for all of us because my MD looks just like his MD, and it's his word against mine as to whether vaccines should be mandated or not. So some of the heavy hitters that we've seen, Vinay Prasad, who's at UCSF, he's an oncologist, an adult oncologist, an epidemiologist who has called for the dissolution of the American Academy of Pediatrics over COVID and over gender affirming care. Sherry Tenpenny, who's in Ohio, also on the grift and anti-vaccine circuit. Simone Gold, who started America's Frontline Doctors and was also arrested as an insurrectionist. And then Joseph Ladapo, who is the Florida Surgeon General, who took over from Scott. I'm wanting to say Gottlieb, and he's the FDA guy. So I'm just going to not say who that was because it's blanking on his name right now. Anyway, who is now in Rhode Island at Brown. So
Rivkees.
Thank you, Scott Rivkees. Thank you, Shuttle. He would be mortified that I couldn't remember his name. So Scott Rivkees was a pediatrician who was the Florida Surgeon General through the first part of the pandemic, and then he wisely resigned his position and saw the writing on the wall, and then DeSantis put in Joseph Ladapo. So it's difficult when you have especially people who are full professors in academic institutions where those institutions are not coming out to say something about the kind of rhetoric that their faculty are spreading. If you're interested, there is a Freedom Summit from America's Frontline Doctors at a church in Naples, Florida in March. $10 to watch the live stream. I think it's $40 if you want to go down and attend in person. But if you want to see what they're talking about, that's there. And here's their heavy hitter speaker list: chiropractor, a naturopath, pathologist, an agribusiness guy, an ophthalmologist, and a couple other folks. There is one peds IM, and that just hurts my heart. So it's hard when they look like us and have the same kind of credentials. You'll also remember the Great Barrington Declaration. This came out 2020, October 2020, where the recommendation was that, hey, everybody just needs to get COVID because kids are strong and resilient. And Shettle and I were having a conversation before we came on tonight about, we don't have a great track record with viruses. Hepatitis B and C cause liver cancer. Decades later, measles causes SSPE. 10, 15 years down the road, HIV kills people. We're not really sure that we understand what Epstein-Barr virus does. Why we think that kids getting SARS-CoV-2 over and over again won't necessarily cause terrible harm 10 or 20 years from now, I don't know, because we don't have a very reassuring track record with the viruses that we deal with. So how fringe anti-science views infiltrated mainstream politics and what it means for 2024. So here's the flip, right? So you've got this decline in adults who believe that it's important for kids to be vaccinated in order to go to school. But when you look at where that decline is coming from, it's largely from Republican and Republic-leaning people. And the people who identify as Democrats or left-leaning are really fairly steady over the last few years. But again, this quote, expertise alone is insufficient when people mistrust the expert's motives. And um, when we look at, this is from the Pew Research Center, it just recently came out. When you look at how people value scientific research and progress, you see that about a third in this study of Republicans and people who lean to the right are saying that US government investment in science is not worthwhile. That we're seeing this aligning politically kind of across the board. And I thought this quote from Tom Nichols, who's a political scientist, was really interesting. So we think expertise is this very exclusionary idea, which it is because it's supposed to be, and not everyone gets to vote on how we fly the plane. But the rejection of science and of expertise has become a demonstration of political loyalty. That's the part I didn't expect, that there would be an entire political movement to basically disavow science. And so this has been so largely espoused as part of the identity of people who have a certain political bent that it's very difficult to understand how to message and how to get us out of whatever this tailspin is that we've been in. And so this from actually April of 2022, why being anti-science is now part of many rural Americans' identity. And I would argue that it's not just rural America. It is people who lean to the right of the midline are, more and more espousing these anti-science beliefs as part of their identity. So what do we do about all of that? Tip O'Neill said all politics is local, probably while he was having a beer with Norm in Cheers. And it is. I mean, things happen on the national stage, and it's important that we're there and that our voices are there. But we also have a lot of national support to be able to do that. But the on the ground stuff with the farmers and the accountants and the bankers and the realtors that are sitting in the legislative seats in our states, that is where we really need to be talking to people. And I would hear over and over and over again from legislators, we only hear from the other side, from the opposing side. We only hear from the anti-vaxxers and the conspiracy theorists. We never hear from the people who are actually grounded in science. So there are a couple of resources. One is, there's not a lot of folks standing up for public health. So there is actforpublichealth.org, where you can go on there and they have a little tab that you can click that tells you what's happening in your state and everywhere else. And where you can report things that you're seeing and where you can ask questions and get help. And so even if it's just that, instead of doom scrolling X, you go to Act for Public Health and just see what's happening in your state. And maybe it's one of your legislators that you have or could have a relationship with where you can have some influence. And then get involved somehow. Your AAP, AAFP, ACOG, State Medical Association, Moms Demand Action, Immunization Coalition, State Public Health Association, Grassroots Coalition, whoever needs you and they need your voice. And this is not a spectator sport. And so anything that you can do to make sure that they are hearing us, the people who understand science, that can explain it, that can help them understand why the conspiracy theories and the disinformation that they're espousing is wrong, that they need to hear from us. And so I know you're busy. I'm busy too. But please, if it's an email, if it's a phone call, if it's going out to coffee, please find a way to help some of the grassroots organizations and make connections with people who are making the policies in your state. And I will stop there. And I'm really excited to have any kind of discussion. You can email me at mdfiscus@fiscusmd.com. Thanks so much for listening. I really appreciate it.
Thank you so much, Dr. Fiscus. We have a couple of people basically just complimenting you on the talk and thanking you. So I'm going to start off this by asking you a question about the rhetoric regarding COVID vaccine, which of course was very politically entangled as you reviewed, but how that's beginning to really move into what pediatricians have always known there's some vaccine hesitancy, but has really accelerated hesitancy around the long-standing, one would hope, well-established, quote unquote, childhood vaccines. The number of children who are now entering kindergarten nationally under fully immunized has declined to its lowest rate in over 2 decades at approximately 92%, which, as we all know, with measles just down the road in Philadelphia, from where I am in New York, is quite sobering when the herd immunity rate is 97 to 98%. So I was wondering if you could just take a few minutes to speak about how your perspective on this sort of institutional creep, if you were, on going into the traditional childhood vaccines. How did that happen? Was this just, it's just getting bigger and bigger and bigger, where that used to be experimental COVID vaccines, mRNA, change your genome type problems. And now we're talking about, where we used to have lines of people who wanted to get the polio vaccine, and we now have people saying, not that.
Yeah, it's funny when we were going through all of this. So I've met Peter Salk, who's Jonas Salk's son, who's in California, and I thought about calling him up and just saying, okay, there must have been this kind of crap in 1950, whatever. With there must have been the naysayers. Like, how did you deal with that? And I one of these days I'm gonna catch up with him and find out what he knows. Um, I think there were a lot of missteps for one. There was so much attention brought to how vaccines work in COVID. No one knows anything about, you know, vector, vector derived vaccines, plasma protein subunit vaccines. And there was all of this, mRNA, and it sounded so spooky and a lot like DNA. And, I think that was misguided in getting so into the weeds. Just, everybody knows what mRNA is, or what they think they know what it is. They don't know what it is. But, that you hear legislators talking about how we need to ban all mRNA, and, the scientists are laughing. So that was part of it. And then certainly there has been this growing vaccine hesitancy. I separate people who have lack of confidence in vaccines from like anti-vaxxers. So the anti-vaxxers to me are like the rabid mask wearing, crazy people who never in a million years are they going to get anybody vaccinated. But the parents who are like, I think I want to space them out, or I read this Sears book. Those are the people I'm talking about that would come into my practice because it was a kind of an affluent community that I worked in. And so that has certainly grown. And it's really out of fear that, they don't want to make a mistake and do something to their kid and regret it. And there's this great cartoon of a nurse with a syringe and a mom holding her baby off to the side away from the nurse, and over here is this great big like black goblin thing that you don't even know what it is. And getting parents to realize that choosing to not vaccinate your child isn't not making a decision. It's making a decision to leave them vulnerable to those diseases and trying to help them understand that, while inaction feels safer, it really isn't safer. Um, and then just the spread, in the mommy groups and the Facebook posts. And I remember in February of 2020, so we had first gotten our cases in the United States, but we didn't have any cases in Tennessee until March 5th. And I know that because I was on call for the state. I will never recover. Um, we had this little dinner party, and it was people from our church you were supposed to have over that you didn't know. And so I think there were 10 of us. And this guy kind of leans across the table and he says, "So what do you think about, this whole China virus hoax thing?" And I said, "Well, I think it's going to change the world as we know it." And this was like the middle of February. And he's like, "Oh no, it's just a hoax. Nobody it's just nothing." And his wife leaned over and said, "You do know what she does for a living, right?" And he's like, "Oh, I know what she does for a living, but I still don't believe it." I would like to find that person and see, kind of what he thinks 4 years later. But, even then, that was February of 2020, before mask mandates and shutdowns and vaccines and mRNA, before any of that stuff. And there was already that percolating, "This is a hoax, don't believe what they're telling you" kind of thing happening. And it was in my kitchen. It's that whole thing fascinates me, that was already happening. And we didn't even have a case in the state of Tennessee yet at the time. I don't know if I answered your question.
Yeah, I think well, there are a couple of points. I think the first thing is that with the ability of the public to sort of focus on one thing and then not to be able to discern, like you said, the distinctions between the different component vaccines, and then just to let that fear sort of broaden, um, is, I mean, the way things have been going is essentially almost inevitable. So I think that that's one thing that we have to be very, particularly those of us who do public health work, and pediatricians, of course, even though I'm a neonatologist, it's all, pediatrics is the medicine of prevention for the most part. Um, but I also think that the point that comes out of your talk, as sobering as it was, is that, we practice medicine in clinics, we practice medicine in the ER, we practice medicine in the hospital, in the delivery room, in the ORs, but we have to practice medicine in the state house. And I think that that is something that a lot of people need to understand. We can't, we can no longer just say someone else is going to do it, or the medical societies are so strong in the individual states that none of that will ever happen, right? And I think the fact that you pointed out that some of this is happening in states that are not quote unquote red
Mm.
really shows the power of the power that this message sometimes can carry with it. And that's really concerning because I think you're right. I go to our state capital fairly routinely, and I'm pretty sure that I'm one of a handful of physicians who will probably walk in those halls. And there are a lot of angry mothers. There are a lot of people who are upset about mandates of any kind.
Mhm. Yep, they're
And
there every day,
right,
talking,
exactly.
talking,
They come two or
calling,
three
phone
times a week.
banking, sending
Yes.
letters. I mean, they're very, very passionate. We're very passionate too, but we tend to more talk about our passion than do our passion, I think.
So this brings me to my sort of next question, and then there is a question in the chat that we'll get to after this. Is that it seems like there's almost like a two-tiered strategy that we need to work on, right? There's this sort of higher level state-based, get involved, like you said, with with an organization, whether it's your AAP chapter or your medical society in that state. But then there's also the sort of much quieter individual patient one-on-one counseling.
Mhm.
And I was wondering, I mean, obviously now shifting a little from Shelley Fiskus public health icon to Shelley Fiskus physician in exam room 4, how do you how do you work with the vaccine hesitant parent who is not in the 2 to 5% who are completely anti-vax and you're just never going to convince and it's not worth it. But how do you work with the people who are really in the gray zone, who are skeptical and hesitant and maybe come from a place of good intention, but still worried?
I think, we've learned to meet them where they are and to listen more than we talk. And so, inviting that dialogue of, well, tell me what you've heard that makes you worried, because you and I both want the same thing for your child, and that's for them to grow up healthy and happy. And we both want that, but tell me about what your fears are, because so many times their fears can be it can be, I'm afraid of needles, but we're interpreting it as, this person is afraid of vaccines, or plasma or protein subunits or whatever. But it's just that, I'm needle phobic, and so I'm needle phobic for my child too. Or it may be things that are maybe a little bit easier for us to reassure folks about. I've heard this vaccine will sterilize my child if you give it to them. And where we can really talk about how, I've given it to my own child, I've given it to thousands of children. We have so much wonderful data on HPV vaccine. We now have countries that have not had one case of cervical cancer in women who have received HPV vaccine. Just lots of things. And I think asking permission, which is one of the most important things I ever learned in pediatrics, when you start to have a conversation, is to, what is it that you're concerned about? Can we talk about that? And then, would it be okay if I share with you what my experience has been? And just pausing and saying that phrase, would it be okay? And not assuming that, okay, this person came into my office, and so I am Lord, and thou shalt listen to what I have to say, because you're here, obviously, to learn from me. But to bring yourself to the level that they're on, and actually put them a little bit above you by saying, would it be okay if we talk a little more about this, or if I share what I know? And almost always they will say yes. But in doing that, you can diffuse a lot of the defensiveness and the anger that sometimes comes into those conversations. And I think, Shuttle, where you're talking about kind of the exam room four thing, I think, we have been so beaten down over the last 4 years that when I talk to pediatricians from, all across the country, and family medicine physicians and others, they don't even want to have these conversations anymore, because I mean, it's like our own kind of PTSD. I've been yelled at, I've been cursed at. I don't want to have one more unpleasant conversation. I just want to see the kid and get out of the room and not have a confrontation. And the disservice that we're doing in that, to ourselves, to medicine, to those children that need to be protected. Every single day in the United States, 10,000 babies become eligible to get vaccinated against COVID-19. And in a lot of those cases, those parents have never had a conversation with a physician about why they should vaccinate their child. 10,000 babies a day. And when we just don't want to talk about it anymore, or we're not stocking the vaccine because it's difficult, or, it has gotten a lot easier, we should be considering it part of the routine vaccination service that we provide for children that's recommended by ACIP. When we just don't want to talk about it because it's been an unpleasant 4 years, we are leaving those kids vulnerable to we don't know what in 10 or 20 years. And really, that's kind of the frame that I keep trying to put myself in when I need to have those conversations, is just, I might be leaving this kid vulnerable because I don't want to have a conversation that's maybe a little bit uncomfortable for me. And that's not the right place for me to be in.
Yeah, I also think that there's another piece to all of this, which is that we, over the past, I mean, even prior to the pandemic, have not created an ideal public health delivery system for childhood vaccination in this country. For the non-pediatricians who are on this call, um, you might not know, but the largest insurer of children is Medicaid, and Medicaid does not pay many pediatricians fairly for vaccines. And this was made actually very evident during the COVID pandemic, when you realized that if you went and got a vaccine at your local pharmacy from a pharmacist, and you're presenting themselves, so there's no counseling involved. You're basically going there to get the vaccine. People were getting paid on average more than double what they were getting when a child came into a pediatrician's office to get a pediatric vaccine. So it gets to a point where it becomes cost ineffective to continue this fight and to speak to parents about vaccination. And I think that that's another piece of this, which is that if we're going to rely on the heroism of pediatricians and family medicine doctors and public health physicians and obstetricians to provide these immunizations, we have to create a delivery system where it's as easy as possible for the pediatricians and the doctors to do the right thing and make that the default thing. And it's not just about payment. And this is for a question that had said that any thoughts for what we can do this year in public, given that it is an election year, and any opportunities to advocate? Well, there are a whole host of bills that at the federal level that you can hold your elected officials accountable for supporting. That includes things like the Vaccines Act, which would actually track vaccine hesitancy, the Strengthening the Vaccines for Children program, which would allow children in the Children's Health Insurance Program, or CHIP, to be eligible for the VFC, or Vaccine for Children's program. All these things that seem quite technical, but are actually seismic when we talk about our public health infrastructure. So I'm going to leave the last word. Dr. Fiscus, any thoughts for what we can do in this election year, and any opportunities to advocate?
Yeah, thanks, Shuttle. Yeah, absolutely. The strengthening vaccines for children, the outside of children, we need a vaccines for adults program. The health departments get this tiny little drop in the bucket of money called 317 money, that they can use to buy vaccines for people who are uninsured. And it's so little that they have to choose, as immunization programs, do we buy enough MMR and hepatitis A and hepatitis B vaccine to vaccinate a bunch of people, or do we buy like 1 or 2 doses of Shingrix and HPV vaccine, because they can buy 3 or 4 or 5 doses of MMR and hepatitis A for what they can get 1 dose of Shingrix or HPV. And so most health departments cannot offer Shingrix, HPV, varicella, and several of the other vaccines to adults. And just because they don't get enough money to do it. And so there is level funding in the president's budget for 317. Level funding is not great. I mean, it's better than cut funding, but the price of vaccines goes up constantly, and we've been level funded for a really long time. So we really need support for Vaccines for Adults program. We've got some folks in CDC leadership that are also supportive of that, which is wonderful. Right now, taking the pulse on what's happening in your legislature. I didn't know until someone told me that they had introduced that bill yesterday in Tennessee to roll back the language in statute about parental responsibility to get kids vaccinated. These things come in fast, and they're sneaky, and they come in under the radar. And sometimes they're bills that on their surface seem pretty innocuous, and then you really figure out what the intent is. There was a bill, I don't know if you heard, this is one of those things in Florida where someone had filed a bill to have taxpayer money be used to pay the legal bills of any Florida resident who happened to get into difficulty with the law. And it was totally around one particular Florida resident that they wanted a law in Florida statute to use taxpayer money to pay those legal bills. So you always have to think about what is the undercurrent, what's the reason why we're trying to get this passed, and make sure that they understand, because your legislators don't have time to read them. They've got 20-something-year-old staffers that are doing that for them and are trying to advise them. So they're sharp people, but so often they haven't understood the difference between Medicaid and Medicare, and a pediatrician and a podiatrist. So, we have to be there, willing to spend the time to gracefully and thoughtfully and humbly educate them so that they can give the best advice that they can to their particular legislator, and that they vote as we hope they will.
So if there's a take-home message that I think that it's important to think that when you vote, vote with public health in mind and vote with science in mind. We're going to have to close. I want to thank you, Dr. Fiskus, and I want to thank all the attendees on this Doctors for America Advocacy Grand Rounds. It's been really humbling, sobering. I think on one hand, but on the other hand, I think it's also inspirational because I think your goal of firing people up and sort of energizing them to follow these types of bills and to take action, I think has hopefully been heard. Thank you so much for a great presentation. And with that, we'll close the Advocacy Grand Rounds. Thank you so
Thanks so much
much.
for having me.